Let's be honest, the mainstream medical establishment treats oxygen like it's a free buffet item, something you passively consume until you stop breathing, at which point they might shove a tube down your throat. To your average pill for every ill doctor, oxygen is just there. They ignore the fact that it is the primary fuel substrate for every single one of the trillions of chemical reactions happening in your body right now. If you're in Sarasota, Bradenton, or Lakewood Ranch, and you're looking for hyperbaric oxygen therapy in Sarasota, you've likely realized that the wait until it breaks, then try to patch it approach to health is a failing strategy. You're not interested in just surviving. You're looking for regeneration. But here's the kicker. Most places offering HBOT are doing it half-baked. They give you the chamber but forget the physiological context. In conventional medicine, the only approved uses for HBOT that insurance might pay for are vascular wounds, diabetic foot ulcers, and similar wounds that fail to heal after 30 days of standard wound care, radiation damage, soft tissue and bone necrosis from cancer radiation treatments, bone infections, chronic refractory osteomyelitis, once targeted IV antibiotics and debridement have failed, surgical failures, compromised grafts and flaps with active ischemia after reconstructive surgery, acute emergencies, decompression sickness, and air or gas embolism from scuba diving. Toxins, carbon monoxide poisoning, severe smoke inhalation, or exhaust exposure. Severe infections, gas gangrene, necrotizing soft tissue infections, and clostridial myonecrosis. Trauma, crush injuries, and compartment syndrome. Sudden sensory loss, sudden hearing loss, must be initiated within 14 days. Good luck getting through the red tape in under 14 days. Ischemic events, central retinal artery occlusion, a stroke in the eye, must be treated immediately. Again, good luck with that. Now for what HBOT has been approved for by science but denied by insurance, stroke recovery, typically denied despite landmark studies demonstrating that it can awaken dormant, stunned neurons and stimulate neurogenesis. Traumatic brain injury, TBI, and concussion, used extensively by the military and elite sports organizations. Long COVID and chronic fatigue syndrome. Clinical data show that long COVID is driven by widespread endothelial inflammation and microclots, starving tissues of oxygen, thereby damaging mitochondria. A 40-session HBOT protocol has been shown to reverse this hypoxia, clear brain fog, and restore mitochondrial output. And it works even better when combined with EWOT, peptides, and the right nutritional support. Fibromyalgia and chronic pain syndromes. Brain mapping studies show that fibromyalgia patients have altered brain metabolism and hyperexcited pain pathways. HBOT induces neuroplasticity, fixing the flawed oxygen metabolism in the brain's pain processing centers. And again, it works even better when combined with EWOT, peptides, and nutritional support. Anti-aging and telomere elongation. A landmark study at the Shamir Medical Center proved that a specific sequence of HBOT, 40 to 60 sessions, lengthened telomeres by up to 20% and cleared senescent zombie cells. Basically, if you want the real benefits of HBOT, you'll have to pay out of pocket. So make sure you're getting a comprehensive protocol, not a glorified nap in a tube. At the Age Reversal Technology Center, ARTC, I don't do half-baked. I've spent decades studying the intersection of clinical science, physiology, and holistic health, and I can tell you that while a hyperbaric chamber is a powerful tool, it's only one piece of the puzzle. When you combine hyperbaric oxygen therapy in Sarasota with our proprietary protocols, including EWOT, exercise with oxygen therapy, and specific mitochondrial peptides and key nutritional support, you aren't just getting some air. You are fundamentally reprogramming your cellular environment. Most people think HBOT is just breathing 100% oxygen. It's not. If that were the case, you could just strap on a mask at home and call it a day. The hyperbaric part refers to pressure. Think of your body like a sponge. Under normal atmospheric pressure, your red blood cells, the delivery trucks, are already mostly full of oxygen. You can't shove more oxygen into the trucks. They're at capacity. However, when you increase the atmospheric pressure inside a clinical-grade hyperbaric chamber, you bypass the trucks entirely. According to Henry's law of physics, the increased pressure forces oxygen to dissolve directly into your blood plasma, cerebrospinal fluid, and lymph. Pressure turns your entire body into an oxygen-saturated sponge. This allows oxygen to reach tissues that have been starved by poor circulation, inflammation, or injury, places where the delivery trucks can't squeeze through. For the record, EWOT also dramatically increases dissolved oxygen in the blood, along with another key factor that produces similar and additional beneficial effects to HBOT. This isn't rocket science, it's basic physics applied to biology. Mainstream medicine likes to pretend this is only useful for the bends or carbon monoxide poisoning. They'll wait until you have a necrotic, gangrenous foot before insurance approves the treatment. I find that level of reactive thinking to be ethically bankrupt. Why wait for the tissue to die when we can use HBOT to optimize and preserve it now? At ARTC, we view HBOT as a foundational, though optional, pillar of the Wolverine healing protocol. It's optional because which therapies are used is determined by a collaborative process. We believe you are in charge of your health. We call it your biological sovereignty. While the establishment drags its feet, Researchers around the world are proving that pressurized oxygen is a potent signaling molecule that turns on survival genes and turns off inflammation genes. We apply HBOT for a wide range of off-label, read ahead of the curve, applications. Brain and neurological health. Oxygen is the brain's best friend. We use HBOT to support recovery from concussions, brain fog, and age-related cognitive decline. It helps stimulate neuroplasticity and reduce neuroinflammation. Rapid recovery. Whether you're an athlete in Lakewood Ranch or a weekend warrior in Sarasota, HBOT accelerates the repair of muscle tissue and ligaments by providing the supraphysiologic oxygen levels required for collagen synthesis. Immune support and chronic infection. Many bad guys, anaerobic bacteria, and certain viruses hate oxygen. HBOT creates an environment where your immune system is supercharged and pathogens are weakened. Post-COVID recovery, we are seeing remarkable results using HBOT to address the long-term inflammatory damage and mitochondrial dysfunction associated with post-viral syndromes. Anti-aging and longevity. Recent studies confirm that HBOT can lengthen telomeres and reduce senescent zombie cells, putting it firmly in the category of legitimate age reversal therapy. Degeneration is a choice. If you provide the body with the right raw materials and the right environment, it knows how to heal itself. We just give it the high-octane fuel it needs to get the job done. This is where we leave the standard clinics in the dust. Most places will put you in a chamber and call it a day. That's like buying a Ferrari and never taking it out of first gear. At ARTC, we utilize a sequenced oxygen protocol, pairing HBOT with EWOT, exercise with oxygen therapy. Why? Because biology loves a 1-2 punch. EWOT uses high-flow oxygen during exercise to increase cardiac output, supersaturate dissolved oxygen in your blood plasma, open blood vessels, move blood, and increase CO2, all of which drives oxygen deep into the capillaries and into the tissues, cells, and most importantly, the mitochondria. HBOT uses concentrated oxygen and pressure to saturate the plasma and push that oxygen into the interstitial spaces and at the cellular level. When we sequence these, we create an oxygen flood that no single therapy can replicate. This is particularly powerful when combined with our microcirculation and mitochondrial protocol, which includes nutrients and peptides like MOTS-C, SS-31, and Vizugin. SS-31 targets and helps repair the inner mitochondrial membrane, damaged in virtually everyone. MOTS-C signals the mitochondria to ramp up ATP production. Vizugin signals the blood vessels to repair themselves. Adding HBOT to a peptide protocol is like turbocharging an engine that's already been tuned. It is the ultimate synergistic approach to mitochondrial health and longevity. I get it. People see chamber and think claustrophobia or sci-fi movie experiment. Let's demystify this. First, we use a clinical-grade spherical chamber capable of reaching 1.5 to 2 atmospheres of pressure. Don't be fooled by the tube-shaped soft-shell inflatable bags you see online or in some strip mall spas. Those are essentially fancy balloons that can't reach the pressures required for real therapeutic results. They may provide some benefit, but results are difficult to quantify. Our chamber is a large spherical unit with far more interior space than a tube. It can actually accommodate 2 to 3 people, provided they're family or friends choosing to share the session. When you step into our chamber, the descent. As we slowly increase the pressure, you'll feel a sensation in your ears, similar to landing in an airplane or diving to the bottom of a pool. You pop your ears and you're good. The dive. Once at the target pressure, you simply relax. Read, meditate, do breathing exercises, take a nap, stretch, or listen to a podcast playing from outside. Best practices restrict bringing electronic devices into an oxygen-rich, pressurized environment. Err on the side of safety. The feeling. Most people report a sense of profound calm. Why? Because your brain is finally getting the O2 it's been starving for. You might feel a slight tingle or simply deep relaxation. The ascent. We slowly depressurize, and you step out feeling refreshed, not groggy. No needles, no drugs, no side effects other than accidentally feeling better. In the world of hyperbaric oxygen therapy in Sarasota, there is no one-size-fits-all answer. If you have a minor athletic injury, you might only need a handful of sessions. If we are working on long-term neurological repair or systemic anti-aging, we might look at a block of 20 to 40 plus sessions. Physiological change takes time. You didn't get old or broken overnight, and you won't fix it in 40 minutes. However, the cumulative effect of HBOT is where the magic happens. We are essentially stacking the healing signals to force the body into a state of regeneration. I monitor every patient's progress personally and adjust sessions based on how your body responds. This is precision medicine, not a cookie-cutter franchise model. Learn more about how this integrates with our broader approach on our most popular programs page. If you're waiting for the perfect time to take control of your health, I have some bad news. The best time was 10 or 20 years ago. The second best time is today, right now. Mainstream medicine wants you to believe that declining health is just an inevitable part of aging gracefully. It's a lie. Aging is a biological process, and like any process, it can be influenced, slowed, and in many cases largely reversed. Chronological age is essentially meaningless. The only time that is real is now. Biological age is everything, and it depends far more on oxygen, nutrition, and lifestyle than the number on your driver's license. Whether you're dealing with chronic pain, protecting your brain, or simply want to perform at a higher level than your peers, hyperbaric oxygen therapy in Sarasota at ARTC is the most advanced way to re-oxygenate your life. And when you layer in EWOT, mitochondrial peptides, and the full Wolverine healing protocol, the results compound in ways that standard oxygen therapy simply cannot match. Don't settle for fine. Aim for optimal.